Greetings from the Australian Nursing Federation, the New South Wales Nurses Association, and of course your colleagues across that very big ocean. We too suffer a shortage of experienced nurses. We have an ageing workforce, and our Director General of Health recently described that as a tsunami of retirement facing them within the next 2 years. Now, the factor that might in fact change that is the global financial crisis. In Australia, we have compulsory superannuation, which is a pension plan, and our superannuation funds have lost billions of dollars as a result of the global financial crisis, even those that had nothing to do with the subprime investments. We've all lost a large proportion of retirement savings of workers, and that will certainly make the financial push on nurses to continue to work for longer periods. But in the face of that tsunami, of course, what does the government and what do employers do? They look for another workforce. There's always an easier solution than actually addressing the real issues around nursing and midwifery. And of course that is a push for the third level worker, the unlicensed worker, either as the assistant in nursing or the healthcare assistant. And in Australia we still have the registered nurse role and the enrolled nurse, or the licensed practical nurse is the equivalent. And we have another category called the assistant in nursing, which is certainly our preference to a generic health worker. The irony, of course, is that we're told by the Department of Health that whilst they're trying to push generic health workers on us, that they're not able to employ all of the new graduates from university next year. They simply don't have enough clinical placements. They're also not giving permanent employment to newly graduated enrolled nurses as well. So we have this double talk from government about their concern about the nursing workforce and its shortages, and yet we see newly graduated nurses being left without the opportunity to work, particularly in our public health system. Now, that may be a good thing for our private hospitals and our aged care facilities, but nevertheless it's our preference that they get the opportunity to have experience across acute care.